Hi everyone, my name is Sari Bushman. I'm one of the nurse practitioners at City College San Francisco. Thanks for joining me today. We're going to talk about sexually transmitted diseases. I hope you find something interesting in these slides. And as always, we are more than happy to answer your questions at Student Health. Just please jump on the virtual counter and make an appointment, or you can call us at any time. Okay, we'll get started. So the goals of this presentation is to talk about your risk for infection from different behaviors, the way that STDs are transmitted, rates of common STDs that you hear about, and then a lot of the basics. And we're going to go over this list of STDs, including chlamydia, gonorrhea, syphilis, trich, M. genitalium, HPV, which is also the cause of genital warts, herpes, hepatitis A and B, HIV, and then we'll talk about vaginitis, which is a really common reason that people come in and seek advice for both bacterial vaginosis and yeast. So what is an STD? It's a sexually transmitted disease, and it's an infection you get from having sex. And there's lots of different ways that one can get an STD. The causes are from bacteria, parasites, and viruses. Most STDs affect all people, but people who have a uterus often have more severe issues if they go untreated. Can they be treated? For the most part, yes, or at least they can be managed. So if it's a bacteria or a parasite, then we prescribe antibiotics. And after that course is finished, the infection should go away. Viruses, usually there are not cures, but there are antiviral medications that people can take either on a daily basis if they need it for suppression or just kind of as an as needed basis. Latex condoms greatly reduce, but does not fully eliminate the risk of catching or spreading an STD. So this is a slide that I hope will give you some ideas about other ways. These are a little bit outside the box of ways of protecting yourself from getting an STD. Kissing, mutual masturbation, and dry humping are considered safer sexual activities, and there's really no chance of getting an STD if this is something you're engaging in. Oral sex is pretty low risk. You really will not get an STD if someone is giving you oral sex. But if you do have a sore in your mouth or a cut, some sort of gum disease or an STD in your throat, that does increase your risk of acquiring an STD when you are giving someone else oral sex. Condom use, again, will greatly reduce your risk of transmission. Those are not foolproof, but it definitely helps significantly. And then washing both your hands and the genital area thoroughly, both before and after oral and anal sex, reduces the risk of transmission of most of the listed STDs and conditions that we've talked about. So these are routes of transmission: sexual intercourse, oral genital contact, hand genital contact, anal, mouth to mouth, and then contact with the fluids from body sores. Here's some statistics about STDs. The takeaway point here is that they're really common. 1 in 5 people have an STD in the United States, which totals nearly 68 million. Those were the infections recorded in 2018. And half of them are among young people who attend City College a lot of the time. And we spent a lot of money trying to manage them. So STDs disproportionately affect the following groups: teens and young adults, 25 years of age and younger; men who have sex with men, we use the term MSM; trans people; and people of color. And unfortunately, people of color are at an increased risk of being marginalized, living in poverty. And even if they do have access to a clinic that could possibly test and treat them, there's a distrust of the system. There also can be language barriers, social and cultural discrimination. Providers can have bias, and that can all affect people of color getting the treatment that they need. Who do we test and why? So all women aged 25 years and younger, they tend to be at an increased risk for an STD, and we want to make sure that we catch them before it goes on and could possibly cause damage with the reproductive organs. All men who have sex with men or men who have sex with trans women, which we use the term MTF, male to female. All trans men, MFTM means female to male. And then anyone who's having a sign or a symptom of an STD, or if there's a concern of an exposure from a partner that they don't know their history or anything like that, we are happy to test. So what's included in STD screening? Gonorrhea and chlamydia are the ones that we most often test for. We can use urine as a site, and then depending on whatever sexual practices people are engaging in, we will sample from the rectum, the throat, and the vagina. HIV testing at City College, we use a blood test. There is the option of having an oral swab, but that's not offered at City College at this time. And then for HPV testing, we use a PAP test, which is also known as a pap smear. What other STD tests can be done? So based on risk, we will screen you and ask you some questions, and then test based on if it's appropriate. So syphilis can be done with a blood test. Sometimes if you have a chancre, which is a lesion that's found, a painless lesion that's found on the genitals, then a microscopic exam can be used. That's not done at City College, but we will refer you to a place that does if we find a chancre on your body. Hepatitis panel, it's a blood test. We rarely do it as part of a routine screen, but again, this is based on risk. If people are symptomatic, which means they have symptoms or lesions or something on their body that's new and causing them concern. So for herpes, we would culture these little lesions and send those off to the lab and see if that's what's going on. Trichomoniasis is another test that we send for. We can use a little cotton swab. We insert it into the vagina gently, and then we can look at a microscope, or we send for testing depending on what's needed and what the symptoms are. And then genital warts, that's just a clinical exam, and we would do that in the clinic. So Famil PACT, that's some of you might already have that green card that's in the bottom right corner of the screen. It's a program that provides family planning services to low-income teens and adults who are of reproductive age, and there is no charge that is included when you have a visit that's covered by Famil PACT. It's free to the patient. You're eligible if you don't have insurance or you can't get insurance, or if your insurance doesn't cover family planning like birth control or STD testing. If you have insurance but haven't met your deductible. And then also, even if you do have insurance but you need to keep your services confidential, you are also covered by this program. And then here are the services that are covered: STD testing and treatment, condoms, education from the nurse practitioners, a gynecological exam, including a pap test. We have a whole bunch of birth control that we offer at City College. And then if you're having symptoms of a urinary tract infection, problems with your cycles, any other women's health complaints or gynecological complaints, and then pregnancy testing. So we're going to move on to bacterial infections and go over these 4 that are listed here. So chlamydia, that is the most commonly reported STD in the United States. The concern with chlamydia, especially in people who have a uterus, is that many people do not display symptoms. So you can be infected for a while, not realize it, and then the bacteria can go up into the reproductive organs like your uterus and your fallopian tubes and cause problems with fertility in the future. That's why we want to screen regularly, especially in young people. Males are more often to have difficulty urinating or pain with urination. People will say it hurts or it burns when I pee. Occasionally there's a bit of discharge, but that's more often found in gonorrhea. Females can have an abnormal yellow discharge. Sometimes they'll have spotting between their periods or spotting after having sex. And then we treat those with an antibiotic. Gonorrhea, again, another common STD. Again, it can be without symptoms. Men usually have pain with urination, and they can have a discharge from their penis pretty soon after they come in contact with the infection, or with the bacteria, 2 to 9 days after contact. And women can have abnormal discharge, burning when they urinate, or pain with sex. And that is treated with an injection. Okay, why is testing and treatment important? I briefly touched on this earlier, but if we detect gonorrhea and chlamydia earlier, they're very easily treatable with antibiotics. But if they go on and are in your body for enough time to cause problems, you can have secondary damage. Men, it can spread to the prostate, the testicles, the urinary tract, kidneys, and the bladder. And in women, it can spread to the uterine tubes, ovaries. This can lead to an inability to conceive children in the future, inflammation, and then PID, which is pelvic inflammatory disease, which I'll cover in a bit. So disseminated gonococcal infection, DGI, it's pretty uncommon, but it's an important complication of gonorrhea that I want you all to be aware of. Usually it presents 3 weeks after you're infected, and you have joint pain, which can be really uncomfortable and can be confused with some other injury or some other concern, but it causes joint pain. It can cause a rash on the palms of your hands, the soles of your feet, and sometimes urogenital problems. And then this requires hospitalization and usually antibiotics that are in IV form. So PID, pelvic inflammatory disease, that's when an STD that hasn't been treated moves from the vagina up into the uterus and the fallopian tubes. They become inflamed and pretty uncomfortable. Risk factors, these are important. If you've had PID in the past, if you have a gonorrhea or chlamydia infection, bacterial vaginosis can cause this. I'll go over that in a bit. Having multiple sex partners, being younger, it just increases your risk of getting an STD. An IUD insert while you have an active infection. This will not be a problem if you get an IUD insert when you're not having an STD or an infection. Sex without a condom, and then douching, which I do not recommend. So symptoms of someone who has PID: pain with sex, pain when they are over their lower abdomen. You can have fever, you can have abnormal discharge, and then there's the treatment is with a combination of antibiotics. And again, the complications are listed here. So M.Genitalium, or Mycoplasma genitalium, M.Gen, is an STD that was identified in 1980, and it's a very common cause of male urethritis and is responsible for about 10 to 30% of female cervicitis. We do not test for this at City College, but if we're concerned about this and if we're treating what we think is an STD and it's not going away, we will refer you to a place that does do this type of testing. Women will often report urinary frequency, pain with urination, more discharge, bleeding between periods or after sex, lower abdominal pain. Men can have itch at the urethra, pain with urination, discharge. The way we test for this is using the urine or a vaginal swab, which is done at San Francisco City Clinic, and treatment is with antibiotics. So this is a great visual slide on syphilis, which I'll go over. I find, I'm a visual learner, so I find this to be really helpful, and syphilis can be quite complicated, the different early and latent stages and what happens in between. So as you can see at the top, anywhere from 1 to 2 weeks after being exposed to an infected partner, you will often see a painless genital ulcer, what we call a chancre, on the genitalia, and on the right, on the penis, you can see the chancre right there, the corona, just below the corona. And then it's usually gone after about 3 to 6 weeks. It heals on its own. And secondary syphilis will then develop if you do not get treatment. And you will see usually a rash, sometimes a fever, enlarged lymph nodes. Sometimes you'll have white patches that appear on the skin or in the mucous membranes of the mouth. And if that's treated within the first year, you just need 1 shot of penicillin. But if it's not treated, it can progress to latent syphilis. And that's when the infection can then invade the organs. It can cause lesions called gummas. And then it can continue to develop into tertiary or late syphilis, where it affects the heart and the central nervous system. You can have a loss of your senses and motor ability. And it's usually very easily treated, except when it gets into the late stages. So if you do have late syphilis, you would need 3 antibiotic shots 1 week apart. But if you do develop one of the more complicated infections, it does require hospitalization. These are some examples of what primary, secondary, and latent syphilis can look like. So moving on to parasites, we'll talk about 3 today. Pubic lice, which is basically the lice that you get on your head, but it is in your pubic hair. Scabies, and then Trichomoniasis, which we call Trich. So pubic lice, another word for that is crabs. So the crab lice infest the hair parts around the pubic area. You can see them here in the hair shaft. They're usually transmitted sexually, and they're going to cause itching, and then sometimes red bumps or scratches in the area. The way you treat it, it's pretty easy. It's permethrin cream, 1% cream. Put it in the areas that are affected, and you then wash all of your clothing, furniture, and linens. And it can take between 2 and 3 weeks for all of the larvae to die. And the itching can continue even after you've been treated. So unfortunately, you just have to be a little bit patient. Scabies, it's caused by a mite that penetrates the skin. You can see one on the top right corner. Usually you can see little bumps or lines under the skin, which is where the mites are, and they have their eggs. On the bottom right corner are the areas that are most often affected by scabies. Here in red, that's where they usually like to hang out and bite, or sometimes warmer areas. And itching is bad. Usually it's a lot worse at night. That's the biggest complaint. Again, you treat with permethrin cream, but it's a 5% cream that you use from head to toe. Anybody who's a sex partner or a household contact needs to be treated at the same time. And again, all clothing and linens and towels need to be washed on hot if they've been used recently. And if you're not able to wash something, you can put it in a plastic bag for 3 days and set it aside, and that should take care of it. So trich is another parasitic infection that's transmitted through sexual intercourse. Women will usually have an unpleasant smelling discharge, itching, burning, painful urination. Sometimes the discharge is frothy. It worsens after you have your period. And men sometimes have no symptoms at all. Occasionally you'll have a little bit of pain with urination. This is treated with antibiotics, and partners also need to be treated. Any partner you've had in the past 2 months should get treatment. We are able to give a partner pack at City College, or partner packs, depending on the number of partners you need treatment for. And then you can deliver treatment to them directly if they're not able to go in and see a provider. Having trich and being infected with trich can increase your risk for HIV infection as well. Okay, we're going to move on to viral infections, and these are the ones we're going to cover: herpes, HPV, genital warts, hepatitis, and HIV. Okay, so genital herpes is transmitted from skin-to-skin contact. So even if a partner is using a condom, it's still possible to have, when the skin touches, to transmit infection from one partner to the next. The virus remains in certain nerve cells for life and can flare up from time to time, especially when the immune system is weakened from stress or illness. And there is no cure at the present time, but there are antiviral medications that people can take either as needed or on a daily basis if they're having a number of outbreaks each year. So herpes simplex virus type 2 and type 1 can show up anywhere in the vaginal area, on the penis, around the anal opening, buttocks, thighs, and mouth. And even though typically HSV1 is associated with sores in the mouth region, it can also be found in the genital region and vice versa. And the first time you have an outbreak, you usually feel pretty crummy. You have like flu-like symptoms, body aches. But then as infections happen over time, they usually do not feel like that. And you just have a sensation that's like a burning sensation. And that's usually when people start their antiviral medications, at the first sign of that, when they have that burning sensation, and maybe some redness that eventually blister up. Here are some images of active herpes infections on the vagina and around the labia and on the mouth. So I just want to normalize herpes here in this slide and let you know how common it is. It can be as many as 1 in 3 adults can have the virus. And the key take home point is that most people don't even realize that they have it. 80% of infected people don't know they have the virus because they either have never had an outbreak or have very mild symptoms. And about that same number of people who are transmitting the virus don't even realize that they're doing so. And oral herpes is commonly transmitted to the genitals through oral sex, which I mentioned earlier. About 50% of genital herpes is caused by the oral cold sore type, which is herpes simplex 1. You can pass the virus when there are no symptoms. Condoms decrease that risk, but it doesn't completely get rid of it. And the other thing I like on this slide is the emotional impact piece here, that being diagnosed with genital herpes is usually much worse than the condition itself, and it really doesn't deserve the upset that it usually causes patients. So HPV and genital warts, there's over 100 different strains of HPV virus. People infected with what we call a low-risk type of HPV can develop genital warts. Those can be treated in a variety of ways, either with medication or being frozen with liquid nitrogen. Occasionally, if they're really big, they might require surgical removal. The complications of the HPV virus is something called dysplasia, which is a change in cells that can lead to precancerous condition, which then can possibly lead to an increased risk of cervical cancer. So that's why we do things like a PAP test, where we're screening for changes in the cells on the cervix. Here's some examples of what genital warts look like on the genitalia. HPV vaccination is definitely a wonderful option for people aged 9 to 45. It helps prevent cervical cancer, anal cancer, and genital warts. Best if done before someone becomes sexually active, but still we highly recommend it even if you have become sexually active and you haven't had this vaccine yet. We offer it at Student Health, and we can get you a greatly reduced cost there as well. So what's a PAP test and what's a pelvic exam? So a pelvic exam is a way that we can examine the vagina, and we can do that with or without a speculum. So on these pictures below, we'll use a speculum, which is the purple device on the left. You insert that into the vagina, and you can visualize the cervix, which is at the base of the uterus. And that's how you can collect a swab to see if someone's having an infection. You can test for STDs by swabbing that area. BV and Trichomoniasis and yeast can all be detected that way, and you take that swab and you look at it in the microscope. And then a bimanual exam, which is the exam on the right, where the practitioner is inserting 2 fingers into the vagina. That used to be done with every single pelvic exam, and these days it's only done if someone's having complaints of pain with sex or some other concern that really warrants an exam, but that is not something that we do on a regular basis anymore. So when should you get a PAP test? Between the ages of 21 and 29, it's every 3 years, assuming that the PAP tests come back normal. And then when you're 30 to 65, you have 2 options. You're either going to continue to do it every 3 years, assuming everything is normal, or you can do a co-test, which is the PAP plus HPV testing. And if that is normal, then you do the test every 5 years. And you can see on the bottom left, someone is collecting cells from the cervix, and again, using a speculum on the right. Okay, so vaginitis, it's an infection in the vagina, really, really common reason that people come into clinic and get seen. BV is the most common, bacterial vaginosis, followed by candidiasis, which is also known as a yeast infection, and then trich is the third one. Okay, so what factors affect normal vaginal flora, which is like the balance, the ideal pH balance of the vagina. So douching definitely will affect it. We don't recommend it. I always tell my patients the vagina is a self-cleaning oven, and you don't need to clean for it. Antibiotics can sometimes throw off the pH and and get rid of the good bacteria in there, and then lead to a yeast infection. Hormonal changes can impact the flora, hormonal contraceptions, sometimes tampons, diaphragms, IUDs, and then semen, and your period as well. So BV, most people complain of a fishy odor, like a bad odor, fishy odor. The discharge is usually thin and white, and sometimes you can have pain with urination, which can get a little confusing with a UTI. But having the odor in the discharge is part of the diagnosis. BV is super common, especially in women between 15 and 44. It's the most common infection. About 29% of women in the United States are affected by BV, and 50 to 75% of women who have BV have no symptoms, which is fine. It's not harmful. It's only if it's causing you symptoms that you do want to get it treated, or if you're pregnant. So BV is an imbalance in the flora, not an STD. If you are a female with female partners, your partners need treatment. Male partners do not. BV is more common in sexually active women, and we do give antibiotics either in the form of pills, or occasionally we'll do a gel if that's preferred. So a yeast infection, it's not an STD. It's just an overgrowth of fungus in the vagina. And it's usually found either inside the vagina or around the tip of the penis in men. For women, they usually complain of pretty intense itching or burning. The discharge here is going to be white, but it's going to be much thicker and cheesy, like a cottage cheese-like discharge is kind of what we think of. The vulva can be red, have some scratches, swelling, cracks in the skin. And then this person on the left is taking a cotton tip swab of the discharge inside of the vagina, and that's what you look at underneath the microscope, and we can diagnose that in the clinic. Treatment of your partners is usually not necessary unless they have symptoms. For men, symptoms is that the tip of the penis can have yeast, and you'll see itching, redness, discharge, and it is a bit more common in men who are not circumcised. Antifungal pills are usually what we offer first. Sometimes we'll offer a cream too for men, and that should take care of the infection. And just one more bit of advice with infections. If you do have an infection that's being treated, you want to make sure that you take all of your medication so that you complete the course and you can knock out the infection completely. You don't want to have sex during that time. Usually we tell people not to have sex for a week. And we also want people who have partners to get their partners treated and to make sure that they're treated and have waited a week before resuming sexual activity. So we're going to move on to hepatitis. It's an inflammation of the liver, and you can see the liver highlighted in the top picture here. It's often caused by infections, alcohol, and medications. And Hep A, B, and C are viral infections that can be passed through sexual contact. Hep B is actually a lot more contagious than HIV. Can be spread by unprotected sex, tattooing, ear piercing, body piercing with an infected needle, sharing needles or equipment to inject drugs, sharing personal items such as a razor, and from an infected mother to her baby during childbirth. So HIV, it stands for human immunodeficiency virus. It affects the person's immune system and makes it harder to fight disease and infection. There is no cure, but there are medications people take to basically make it so that they do not, there's no detected viral load, which means they cannot actually pass on HIV if their viral load is 0. But it does require being in care and being on medication on a daily basis. And San Francisco is making progress in HIV prevention and is on track towards getting to 0 new infections and deaths, which would be amazing. So in San Francisco, here are the HIV statistics. New diagnoses are down. African American and Latino men have seen fewer new infections in 2019 after a slight increase before that, and same with our homeless population. But again, vulnerable populations are still disproportionately affected. by higher HIV diagnosis and poor care outcomes, especially people living in poverty. This is a nice visual chart of people who, when they have acute HIV, they're first infected, they can feel pretty crummy. They have night sweats, mouth ulcers, fatigue, chills, muscle aches, rash, fever, and swollen lymph nodes. Mostly HIV is transmitted by unprotected sex and infected needles. And HIV used to be transmitted through mother to baby and infected blood products in the United States, and those are really not risk factors anymore. So HIV prevention has become a huge part of sexual health in this day and age. There's no vaccine, but there's something called PrEP and PEP, which is offered pretty widely available. We don't offer it at City College, but we can easily get you connected with a place that does. So PrEP is a medication that you take either before having sex on an as-needed basis, or you can take it daily. And so that's to prevent HIV infection. And then PEP is post-exposure prophylaxis, meaning that in the past 72 hours, you came into contact with someone, you don't know if they're HIV positive, and you want to make sure that you don't get HIV. So you take 2 medications for 28 days after the fact. And I like this image here on the right. You know, he'd tell me if he's positive, and the other person's thinking, well, he'd tell me if he's negative. So this just gives patients more control and more protection, which is great. Many who have sex with men who are on PrEP do get a full STD check every 3 months. We also encourage condom use to decrease risk of HIV along with other STDs, and of course, communication with partners. Just to piggyback on what I said a minute ago about PrEP, it's for people who do not have HIV. You can either take it as an as-needed basis, which is called the 2-1-1 method. So if you're only having sex once a week or less, this is a nice option where you take 2 pills 2 to 24 hours before sex, and then 24 hours after that, and 24 hours after that. Otherwise, you're taking it on a daily basis. So partner notification, I mentioned briefly when I was talking about Trich. It's a nice way that clinics can offer partner treatment when a patient is diagnosed with an STD. I have chlamydia and trich there because those are infections that are easily treated with oral antibiotics. Gonorrhea and syphilis, really the best bet in getting treatment for those is through an injected antibiotic. So we really encourage partners to come into clinic and be seen. And then we want patients to notify their partners anyone they've had sex with in the last 60 days. We want them to tell them to go in and get tested and get treatment. And if you don't feel comfortable doing that, that's no problem. There are ways to do it anonymously. Tellyourpartner.org is a website where you can notify people that they've been exposed to an infection, and you don't have to disclose who you are. So ways to protect yourself, barrier methods are condoms and dental dams. And then through vaccination, there's Hep A and B vaccinations, HPV vaccinations, and then meningococcal vaccinations, which are used more in men who have sex with men. So male condom, it comes with or without spermicide and with or without lubrication. You can also bring your own lubrication, and when it's used consistently and correctly, it can be up to 98% effective to protect against some STDs and HIV. But again, they cannot protect you fully from infections that are spread from skin-to-skin contact, like herpes and genital warts. How to use a male condom. This is important. If you don't use it correctly, it's not going to work for you. So it's important to pinch out the air at the tip and then roll the condom down the erect penis. And if it's not rolling easily, you probably have it in reverse. So you need to flip it around and it should roll easily down the penis all the way to the base. If you can, smooth out any air bubbles. And then after ejaculation, you want to make sure that you hold on to the base of the condom at the base of the penis and withdraw the penis from before you remove the condom. Okay, so female condom, that's another option. It's a single use, soft, loose fitting condom. It's meant for internal vaginal sex or anal sex. This is how you use it. You're going to kind of pinch the top part, insert it into the vagina or the rectum. You want to place your finger inside of the condom, push it up as far as it will go. Make sure it's not twisted and that the outside ring remains either outside of the vagina or outside of the anus. And then when you're finished, you want to twist the outer ring so that no semen leaks out. So spermicide, that does not protect against STDs, and it actually can increase your risk of getting HIV and STDs because there's a chemical in it called Noxyl 9 that can irritate the vagina and actually make it easier to get an STD. So dental dam is a way to protect yourself during oral sex. If you don't have access to a dental dam, you can use good old-fashioned plastic wrap, like saran wrap, which is sold everywhere, and that can work as well. It reduces the risk of STD infection, herpes, genital warts, and HIV. Safe is sexy. Really encourage you to talk to your partners and protect yourself. And if you have any questions or concerns about what I talked about today, please do contact us. We are happy to help you and talk through whatever you have going on, work on the testing, offer you birth control. We would be glad to have you in. Thanks for listening.